Hi guys. Um, this is Don Jr. lamenting LA's new reinstatement of a mask mandate, which while it'll keep you from getting the flu, common colds, any kind of respiratory illness whatsoever, it's useless against COVID. Clearly, guys, guys,
Guys, authoritarian.
guys. I touch my thumb and my finger to help me seem serious and remember my points. Guys, okay, check notes.
Are gonna authoritarian. That's what they do.
Authoritarians are gonna authoritarian. Jesus Christ.
That's what happens when you give up your rights and blindly follow dictators. So,
Yeah, nobody's blindly following dictators. Seriously, a mask mandate that you can take off your mask to eat and drink, which in a movie theater everybody does, which in a restaurant everybody does, which in a bar everybody does.
in breaking news,
Okay, is there an echo on this guy? Hold on. Yeah, that's a weird one. Let me see if I can fix that. Hold on.
on Thursday afternoon, Los Angeles County.
Okay, why is that? Let me see. I can guys, work with me, guys. Let's see. Let's turn this guy off. Built-in output. I'll turn that off. Maybe there's two versions of it here. Let's see. Hopefully this will carry some of it. There's a weird, I hear a slapback to it.
In California, just announced that it will reimpose an indoor mask mandate.
Dude, are you he's reading again? Hold on, this is good. All right, so I think. All right, thanks for hanging out, guys. It helps me work out the kinks. I'm gonna open my Wavelink sound software and see if that's what's causing the double loop, because it very well may be the culprit. We'll try it out. We'll see. Or it might be just...
Regardless of your vaccination.
Okay, regardless of your vaccination status. Yeah, that's because they have a choice, stupid. Here's the choice. You can either start asking people their vaccination status or just say, everybody put your mask back on. And the reality is that asking everybody to put their mask back on is a lot safer than saying, no, we're going to need to see your vaccine card, because one of you assholes will go nuts and shoot a bunch of people. That's what this is all about. That's the really big scare here. Hold on.
Status beginning Saturday night at 11:59.
What is that? Doubling up of the desktop audio on this thing.
9 p.m. Now, a couple of things come to mind. We've all read the Fauci emails. We've all seen what even he thinks and says about masks. It's not necessarily in line with the narrative that we were sold for 18 months. But
it's exactly in line with the quote-unquote narrative that we were sold for 18 months. The science on whether or not masks would be effective stopping something like COVID, more so than, say, staying the fuck home, had some wiggle room, some debate. I mean, obviously, doctors wear them so they don't spit shit into your wound while they're, doing surgery on you. In infectious disease wards, nurses and doctors wear masks themselves so they don't breathe in some of your particulate. But the question about whether or not a coronavirus or a flu or specifically COVID would be able to beat a mask, like whether you're just wearing something and it's not going to be effective, or whether or not it would stop you from spreading it or someone spreading it to you, there was no definitive science. There was a lot of anecdotal information about it. But they don't deal in anecdotal at the CDC and the NIH. They have, safety and best practices is probably a good idea. But at a certain point, if you're vacillating between don't go anywhere or go out wearing a mask, we don't know whether masks will help or whatever, whether it's going to do any good or stop it or not. So stay the fuck home. This is initially the beginning of it. And then by June, multiple countries had done multiple studies on whether or not wearing a mask stopped you from spreading it and stopped you from getting it specifically. And the reality was that not only Even the shitty masks that some people wore, while it didn't stop them from getting COVID, lowered the viral load of them getting it so that they didn't need hospitalization. Their body wasn't overwhelmed when it was fighting it. It could arguably be the reason why a lot of it was asymptomatic was because especially in the beginning, the viral load was so low because it was, amongst all this other shit that's in the air, they were able to fight it off. People were able to fight it off. But as more and more people around you have it, you get more of a dose of it, and then that's mainly why this Delta variant, murder spree is happening amongst the right. No one anywhere is saying, there really is no information, it's all a lie. Masks don't help. It's just dumb. It's just, it's a narrative from his point of view. Jesus.
But regardless.
With regard to wearing masks, the science has spoken. Last June, definitive studies came in across the globe saying, actually, not only does it stop you from spreading it, but it lowers the chances of you being hospitalized or dying if you do get it, because you get less of it in your body, and your body has more of a chance to fight it off.
We all have seen it. We all understand the efficacy.
No, you don't.
Also heard a lot about if you get vaccinated, you can go back to normal. You're not going to be at risk. Why would you have to worry about mask mandates?
Because we were dealing with the wild version, not the Delta variant, and the Delta variant, because it ran wild and was a mutant strain that was incredibly strong, that grew out of India and started spreading around, especially in the UK, and then came here, that they don't know the science on whether or not your vaccine will be able to protect you enough from it, statistically enough. Now, obviously, the statistical danger you have starts getting into lower than seatbelt territory. The number of times you wear a seatbelt versus the number of times it saves your life is very minimal until you're not wearing one on the day. See how that works? Dipshit.
Et cetera. But more important...
Et cetera.
If this was such an emergency, remember, we're in a pandemic. People's lives are at stake. You're going to kill your grandmother.
No, I'm not going to kill my grandmother. My grandmothers are all dead. I don't want to kill some grandmother I've never met.
Remember the things we've heard for the last 18 months?
Yes, you sounding like a coked out asshole at a party, your panic attacks, your weird glassy-eyed, confused way of saying, guys. Yeah, I remember all that.
Out of curiosity, if it was such a health crisis, and we were so concerned, why would we wait 3 days to actually impose it? Why wouldn't we do it immediately?
Well, because the people who would enforce it, or the places that, like, businesses would have to make sure that they have masks and stuff stocked up after they had maybe gotten rid of them, maybe thrown them out, maybe stopped using them. That's why. And a lot of people were encouraged not to go out during that period. So there's a kind of rolling time. He's just dumb.
Why wouldn't we do it right now? Maybe you give some people...
I don't know. Maybe that's a good question to ask your dad about the China, banning China. Because he waited 3 days to ban China. He signed the paper and said it doesn't take effect till Monday. And that was way bigger than L.A. Realizing that they've got to reimpose a mask mandate.
Some leeway till they hear the news.
And by the way, that was before everybody kind of was aware of the danger. Your dad was obviously aware of the danger, but the rest of the country wasn't necessarily. He had been lying. He was downplaying it. He admitted to downplaying it. Whereas in Los Angeles, as the news kept coming out that the Delta variant was around and stuff, a lot of the people who were concerned or who hadn't been vaccinated started wearing their masks again. And a lot of people who weren't wearing masks and going out and going, yeah, I've been vaccinated, and the little signs that says, if you've been fully vaccinated, you don't need to wear a mask unless it makes you feel comfortable and blah, blah, blah. A lot of the people like you, for example, although he's been vaccinated, who haven't been vaccinated are lying about it, were not wearing masks. And so it really is about getting those people masked again. Everybody else was like, these fucking assholes, and still wearing their masks.
Maybe you just let them know when they walk in somewhere, but why would it be implemented 3 days later instead of right now?
Because of the reasons I stated earlier.
It's because that's what happens when you've ceded control.
Yeah, seated control. That's nothing's worse than the draconian steel, the velvet gloved steel fist, iron fist of the Soviet Union, where they would go, 3 days from now, boy, you better stop selling blue jeans.
Okay?
And
Look at
rock and roll music.
this chart. Okay? This is a chart that shows the spike in corona cases. Okay, again, not mortality or hospitalization rate, because that's even less, apparently, than this spike, from what I've been able to garner online. Okay? So,
Yeah, that's where you spend most of your time.
hospitalization and death, obviously the critical factors, much more so than even cases, especially.
Well, no, because we don't know the damaging effects of long-haul COVID, and that might actually have more deleterious effects on the economy and on the nation than ultimately even the deaths. Because if you got a bunch of like people who effectively have a wave of a version of COVID-based fibromyalgia that creates a situation where people the lost productivity gets into the crests over $1 trillion over the next 10 years, that's kind of a major impact.
Now that we're getting closer to herd immunity and people are more used to it and or have had it and are less susceptible, yada, 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 right? Virology that we've all probably learned over the last few years, right?
Yes, the only reason we're doing this is to protect assholes like your dad's supporters. Seriously. My genuine concern about, because I've had the Pfizer vaccine, I am of good health. My two main concerns are kids who cannot get vaccinated yet, and the increased number of children who've gotten the Delta variant because people who are in that 8% window can bring it home, or it's just on your hands and you're forgetting to wash your hands like you did, or you're not taking the regular precautions because you want to go back to normal, and you're rubbing elbows with people and there's a lot of humans around, and you just forget, oh, this is the one day that you slip, and then you give it to somebody who's, is not aware that they're in danger from it. That's the primary concern. The second one, and largely the oddest part of it, and the one I think most people are struggling with, on a moral level you're not, but it's hard to not make jokes about it half the time, is that we're all doing this to save Trumpsters from themselves. Seriously. Most older people, especially people who want to get the vaccine, have been vaccinated in this country. There are definitely children that haven't, but the vast majority of them aren't going to get it because they're so young. The people that are going to get this and die from it are all these, I thought it was fake. No, I'm sorry. They're going to ventilate me. Get the FaceTime. I need to say goodbye using big tech. I have to say a big tech goodbye to my family. That's what it is. I mean, story after story after story of these jackass Trumpsters and maggots who are like, it's all bullshit. Just give me some ivermectin and some hydroxychloroquine and I'll be fine. I can shake it off. And then the next thing you know, they're proning them and shoving a tube down their throat because their lungs are filling up with scar tissue like they have shingles in their lungs. And these are people who voted against, me in the election, what I wanted. They are on the opposite side of the political spectrum. They are on the extreme of the opposite side of the political spectrum. They are absolutely radicals in their own party. And yet it is on the rest of us to not just decide that people deserve to die if they are stupid. I don't believe stupidity is a capital offense. And so, if it happens to you, there's not much I can do about it. But if I can not give it to you, or not spread it, or not be the conduit by which it is spread to someone like, the maggots that follow him, then it is my moral responsibility. That's why I wear a mask when I'm out. To protect, my son, who I think will be, he's well within the safe area of this, but God, if this got him or got a hold of him in any harsh way, I can't tell you where it would just shred my insides. The single thought of that just makes my blood boil. The chances of that are almost, are infinitesimal. There are many other things that I, should wash my hands and avoid so that my kid doesn't get them, like spinal meningitis and shit like that. I had a friend of mine in high school who had to get a spinal tap because of spinal meningitis when he was in school because of pigeon shit under the bridge we used to all walk under to go to the White Hen to get snacks for lunch. We all walked under there. He's the one who got the spinal meningitis from the pigeon shit under the bridge. Like that, and his parents, I can't imagine. His name is Chris. Good dude. One of my favorite people. Just a solid human being. Loved him. You know, he dated a friend of mine. He was in our group of friends. And, you know, just, he was a gymnast. Really good health. And I can't, like, now as an adult, being his, like, parents' age, like, how it would just tear me apart that he would be in, you know, that it, like, I can't, you know, because we were like, oh, fuck, he's sick, this is that, but you're teenagers, you don't really have a grasp on the depth and seriousness of it like the parents do. And I guarantee every other parent around him was like, spinal meningitis, holy shit, it's just awful. Awful. He survived, he lived. He did not, no, we're not ripping him, he survived. But it was rough on him. And his parents were just, like, shredded while this was happening. He was just, yeah, he was just fine. But he fought it off. Because he was a really, like I said, he was a fit, healthy kid. He was on the gym, you know, he was a gymnast. And they did everything right. And they had insurance. And they dumped money. And I remember, I visited him in his hospital bed. We all went down and saw him a couple times. To be, you know, as a dad now myself, looking back at what his dad and his mom must have been feeling, holy shit, terrible. And that's way more normal. That's a way higher chance, you know, at this point than COVID even, statistically. So clean up after yourself. That's why you have work clothes and you change out of them before you hug your kids. And by God, I know this is a total divergent, but this asshole's annoying me. If you do shoot, if you're a gun owner and you go to the range with any regularity, and especially if you go a lot, if you go occasionally, it's not as big a deal. But if you have small children and you go to the range a lot, even if it's outdoors, you are covered in lead dust when you come home. Change your clothes in the garage or outside, like wear a jumpsuit, something over top of it that you can hose down, or leave outside in the wind to let it blow away, to at least dissipate it, because the number of people who have poisoned their kids with lead just because they love to go shooting, and they take them to the range, and they show up at the range, and they come home and puff, hug their kid. You don't think this, like, NRA lunacy is an accident, do you? 1,800 unregulated, indoor, poorly ventilated gun ranges in this country full of, you know, prepper assholes who are like, it's all about family and Christ, as soon as they get home from, you know, emptying their AR-15 35 times. Jesus. So I do that, you know, part of it is for my kid, because be sensible. But the reality is, for the most people, especially when they're going to work, is that they're going to bring it, circulate it in an area where assholes like this are going to carry it to someone who hasn't been vaccinated, and they're going to die. That's why. We're all doing this to save maggots from themselves. And guess what? I'm okay with that. I would rather argue politics and conspiracy theories with some dipshit for 10 years than play any part in their demise. Not gonna do it. Ever. Ever. You guys know I'm a hardliner about this stuff. Like, I don't do the whole punch a Nazi thing. I don't call for physical violence ever in any circumstance. And I catch shit for being, you know, anti-looter and anti-arsonist sometimes on the extreme left. But I have a zero tolerance policy about it, and I'm not gonna let this asshole talk his dad's supporters into dying Jim Jones style for him. Because if I could have, you know, to me it'd be like passing out, not being a Jim Jones supporter, but passing out the flyers.
Time some of these things get weaker. You know, we've heard about a Delta variant, and pretty soon we're going to see the Beta Sierra variant. When the
Hey, asshole. The Beta and Sierra, I guess the BS version is what he's doing. The Beta we've already had. This Delta variant, there's multiple Delta variants. This is the primary Delta variant. He's going the BS, the bullshit one. That's the joke that he thinks.
BS variant comes out, I imagine the authoritarians will be there pushing it even more heavily. But
well, no, if the BS variant comes out, we will know when you have it because you smell like shit already.
Look at this chart.
Yes.
You see that corner on the right, the little circle? You know, middle July? That little tiny spike is why they're going to reimpose mask mandates in Los Angeles County, California. Again.
Yeah, because that, fuckhead, is how this one started and this one started. And these started because they didn't have full mask mandates. This is when the mask mandates ended in a bunch of places. And this is nationwide. So these are all red states. I mean, I appreciate you making this a red line with a pink filler because this is all Republicans. These are all Republicans. And occasionally, I guess, some collateral damage, libertarian independence, the occasional sovereign citizens sprinkled in.
Hospitalization rates and death rates are even less significantly than that little spike from what I've been
Well, yeah, you obviously don't think it's significant when people die.
able to garner. But that little spike on a chart from the New York Times is why they are imposing this. It's why they're starting it all over.
They're not starting it all over. It's a temporary one to get a hold of it because of the rise in the Delta variant, because it spreads faster and it can be more deadly, and there have been children getting it, and that's really fucking scary. That's why. This isn't going to, this probably lasts 6 weeks. That's the whole point, though, is to go, all right, not quite yet, here we go. UK is going to have to do a total lockdown.
It's why they're exercising their control. And again,
what control, dude? That's like saying, if there's a law against, surfing in a hurricane.
Because we've allowed it to happen. That little chart from the New York Times.
Well, you let it happen by your dad losing the election, I guess.
Not exactly a conservative publication. Not exactly.
I would say TYT is fake news. Sure.
Maskers.
And vast maskers.
Not exactly anti-vaxxers.
Not exactly.
Liberal publication. That's the spike that's causing LA to crack down. And again, it's so important and serious that they're not doing it immediately. They're going to wait 3 days. Guys, watch what's going on.
Watch what's going on. Yeah, what's going on. Apparently, isn't it really difficult to have a super authoritarian overlord that gives you a 3-day vacation on shit when they are helping you gear up for it? Let's see. Rise in Delta, variant, Los Angeles County. Now, there's a reason why, in particular, it had nothing to do with this. He's saying the statistics in, let's see. Yeah, here we go. Okay. Wink. Here's the issue, is that a lot of people got the Johnson & Johnson one and done. And it has the least amount of efficacy against Delta. And so this is what we're seeing in Los Angeles. Delta variant in Los Angeles, 20% of COVID cases now among vaccinated residents. 80% are unvaccinated. So if it can spread through the vaccinated populace, the cases, by the way, are not people who are going to the hospital. Those 20% who have it aren't going to the hospital. They're just testing positive, which means they're shedding virus, which means they're spreading it around to the 80% that may end up in the hospital or dying from it. So that's why. It has nothing to do with some rando story or statistic from the there it is. Sorry, from the New York Times. Let's see. Yeah. So, and this is why. Another like version of this. Let's see, blow this up a little bit. Here you go. So, Delta variant is a game changer, said Los Angeles County Public Health Director Barbara Ferrer on Thursday. Ferrer announced that as the Delta variant became more prevalent in Los Angeles County, the percentage of infections happening among fully vaccinated residents is also rising. In March, vaccinated people amounted for only 2% of infections. And that's, by the way, below the statistical probability of like 6 to 8%, of people. So it was way small. In April, that rose to 5%. In May, it was 11%. It stood at 20% in June and is now likely higher. The rise coincides with the rise of the more transmissible Delta variant in the county, which now accounts for 84% of all variants recently identified. There it is. Boink. COVID-19 cases among LA County residents, 16 plus by month, and vaccination status. There's February, 0%, 2%, 5%, 11%, 20%. That also means that the vast majority, there's a huge number of cases going up. There were very little cases, so of course there were 2% because they'd been masked up for a while. There was not the Delta variant. The wild variant was starting to fade, and then this Delta variant showed up. But said Farah, there are still very important reasons for getting vaccinated. If you're vaccinated, the chance of you ending up at the hospital, winding up in the ICU, the chance of you winding up intubated are much less. One reason for the increase, she said, is that more people who are vaccinated, the more people who will end up testing positive. Currently, about 53% of LA County residents are vaccinated. 62% indicated on the county's data dashboard does not include kids under 12 who cannot yet get vaccinated. June 15th reopening may have also had something to do with the spread among vaccinated people, she said. When there's more community transmission, it affects even those who have protection. If you got more people around you who are infected, the more likely you are to get infected. Until we get the transmission under control, masking will help. Speaking of community transmission, Los Angeles continues to see steep increases with 2,767 new cases up from 2,551 on Wednesday and 1,821 on Tuesday. The 7-day average case rate, which was 7.1 1 week ago, has not virtually doubled. That's I think now is what they meant, not virtually. Has now virtually doubled to 12.9 per 100,000. The stat is considered one of the best indicators for the rise and fall of infections because it is both the average and not dependent on the number of tests administered. Cases reported today, there you go. Total deaths, 24,000. Deaths reported today is 13. Currently hospitalized is the big problem. 645 people in LA County. That's 645 beds you can't use for car accidents, heart attacks, strokes, spinal meningitis, what have you. Anything that's acute and the onset is high. Anybody who has massive overdoses or it has to be, put into a chemically induced coma, shit like that. That's your ICU bed for 3-4 days. And if the rolling average eats up most of those, that's when it becomes a problem. One important nuance in the case rate rise is that young people seem to be driving it. While 12.9 per 100,000 is certainly high overall, according to LA officials, the case rate for Angelenos between the ages of 18 and 29 is an eye-popping 25 per 100,000. Certainly a predominant, more transmissible variant is part of it, but the vaccination rate certainly plays into it. While 58% of residents in the age range are vaccinated, the number is 92% among those 65 to 79. Again, these are all people who don't think it's a fucking problem. People like this asshole.
Pay attention, because this stuff is going nuts. I think you should ask if you're from
I'm telling you, it's crazy go nuts. I am happy to have the vaccine, and yet trepidatious, and yet fearful, very exciting, but you look coked out of your brain. I'm not going to lie, darling. I once said to, I was with Telly Savalas. We were playing golf. He played it with the club upside down, a very strange individual. He was like, he called it a gardening pool. I never knew what that meant, but he had the sucker all the time. It was wonderful. And he said, watch out for that Don Jr. He was running around here, a little scamp, about ankle high or whatever, and he was snorting all the chalk off the greens. We couldn't figure out where our balls were,
California, or if you're in Los Angeles County,
It's my Fernando. That's my tribute to Billy Crystal.
ask your health officials. I think you should be reaching out to them. Again, People wear
Yeah, bother your health officials because Don Jr. says so.
a mask, they go into a shop, they sit down for dinner, they take it off, then they put it back. Are we kidding ourselves? Again, if you've read the Fauci emails, you know sort of what he really thinks about the mask, right? It was more about optics than anything, essentially.
No, in the beginning it was, and then the studies came to show that it actually helps. Masks help. I mean, obviously, ask yourself how many colds you've had during COVID, how much flu you've heard about. That's a big part of it. Like, I saw somebody, like one of the right wingers, going, "Whatever happened to the flu? Oh my God! Like nobody had the flu. Like everybody died of COVID. We didn't hear about any flu cases because, yeah, everybody was wearing masks."
What I got from it. So watch what's going on,
Guys, watch what's going on. Watch what's going on. We have to find out what is going on. What's going on?
A religion to them.
Fauci is a fraud. Do your research. Right.
Okay, that's why reasoning, science, physics, it doesn't apply. Only narrative matters.
Physics?
Because that's what
So you mean the physics of droplets flying out of your face and arcing slightly downward?
authoritarians do.
Or the idea that the superfine droplets hang in the air for up to an hour, which is a statistical anomaly about COVID that your father pointed out early on that the science showed. And he was telling everybody to shove a light bulb up their ass.
Pay attention and don't let it happen. Call them out.
By the way, his dad is saying, "Don't let it happen. We can't let it happen. We can't let it happen. Don't let it happen." This is a phrase they keep repeating overall. And I have to say, it's more than a tick. It seems like one of those management books. Like, guys, the quarter is coming to a close. We've got to put some sales. We're looking at the numbers from last quarter. They were not good. We can't let it happen again. We can't let it happen. You guys are responsible. Don't let it happen. Like that kind of phrasing. That's how. Yeah. That's. It seems like that's where it came from.
And make them explain it to you rationally, because to me, none of this makes any sense.
That's because you're dumb. I mean, you're obviously a drug-addled lunatic as well, and with daddy issues, but also because you're just flatly dumb. I don't mean that as a pejorative. I mean it as like a descriptive. Like, you're the only person in the world who's ever grown a beard and made his chin look smaller. That kind of thing.
And I imagine to you, it doesn't either.
No, you imagine wrong.